Good afternoon. It's Anne Marie here on behalf of the Chronic Pain Association of Canada. As Canada's only national charitable organization for chronic pain, we consistently receive emails from desperate pain patients all over the country. These are casualties of Health Canada and the provincial physician colleges' misguided war on opiate medicines and those who require them. They have had their pain medicine forcibly taken from them for no medical reason, with no viable alternative to take its place. It's cruel, it's inhumane, and highly unethical. This afternoon, we are with a Canadian woman that we will call Bonnie. The reason for the pseudonym is because the family of this pain patient we are speaking about today would be very upset to have these details come out in public, so we will respect that. Thank you so much for joining us, Bonnie. Please go ahead with your email that you had sent us.
Okay. Thank you for helping people be aware of the issue of lack of needed medication and suicide. It's a very sad reality in Canada. I wanted to share my uncle's story with you. He took his life last month. Today I received a copy of the note he left. This is what he said in a handwritten note. To my family and to others it may concern. It was my hope that I could die a natural death, but that is not to be. I am too sick to wait. The lack of enough medication for my insomnia and pain and discomfort of other medical problems has made day-to-day living unbearable. I am sorry for any grief that I have caused. To others of concern, going to a hospital ward or the hellhole of a senior's home was out of the question. My uncle and other family members begged the doctors to give him the medication he needed to be comfortable. He was refused. This is a man who was a peaceful, law-abiding person. He just wanted to have the medication he needed so he could function day to day. He was denied. After months of suffering because of this denial, he put a plastic bag over his head and killed himself. Why are people driven to this? Isn't this part of the opioid crisis too? People not having access to medication so they can live with a measure of comfort and dignity? People with severe chronic pain do not contribute to the opioid crisis. They are careful with medication because they know at any time it can be taken from them and they will be forced to endure suffering, often such unbearable suffering that the only way out is death. These people do not sell drugs on the street. They do not abuse medication. They use it to have some quality of life. They use it to function. They use it to be able to contribute something to society and not lie in bed in agony 24/7. Now my uncle is a statistic and a casualty of the opioid crisis, not because he abused medication, because he was refused medication. I just felt the need to share this. I know it is just one story of many in Canada because people are denied access to medication they truly need.
Ooh. And as you might imagine, Bonnie, when we receive that email, it always takes our breath away. It's not the first email, it won't be the last, but every time it takes our breath away. I know it does for me because it's something that was completely and utterly preventable. Was your uncle in good mental health?
suffered a great deal of anxiety, but that was because he couldn't cope with his pain and he wasn't able to sleep. He was in pain all the time, and his insomnia.
Right.
And knowing tomorrow is going to be another day of pain caused him anxiety. However, before this, his whole life, no, he had no mental issues.
So did the anxiety come when they started to take the medication away?
Yeah.
Okay. So there was a time when he had a proper dosage of medication for him, and he didn't suffer from anxiety, and he was getting on with his life as best he could?
Yeah.
Okay. Okay. Was he close with his family?
I would say yes. Yeah.
Yeah. Did your uncle have any children?
No, but my siblings and I didn't have our father in our life, so our uncles were almost like surrogate fathers.
Oh,
And he was a very kind-hearted person,
yes.
very private,
Yes.
worked hard, was very good to his extended family. And he did not deserve this. I believe that the medical community really let him down, rather than being able to die in peace and comfort.
Right.
He took his life in this horrible way. And I know that wasn't something that he would do had he been able to be comfortable.
Right, right. So, like, I understand that his, well, I suppose his death certificate will probably say, suicide by asphyxiation, but what was the real cause of his death? That wasn't really what caused his death.
No, I believe the cause of his death was lack of medication. Medication that's available
Mm-hmm. That he did have at one point.
and that doctors refused to give him what he needed to be comfortable.
Right. And we have this situation where, I mean, this death, as well as the others, is policy driven, entirely preventable. Entirely preventable. Oh, has your family ever talked about taking any legal action, or would that not be because of the privacy
No, I
issues?
don't think they would. I think it's, they're probably not going to even talk about it much. I sent the email to you because I wanted his death to mean something more than he just died. You know what I mean?
Yes. Yeah.
He died really for no reason other than policies that are not good health care.
Right. Right.
I mean, it's my understanding doctors take an oath to do no harm. And when there's medication available to help people and to alleviate suffering, and they are refused to give it or not allowed to use it, that's doing harm.
Correct.
It's doing terrible harm to people.
Correct. Terrible harm.
Who need medication to function.
Right.
And I cannot imagine them doing that with anything else. I mean, can you imagine if for some reason people started to abuse blood pressure medication? Would they deny all people access to blood pressure medication?
Never.
Or would they deny diabetics insulin because some people have started to abuse it?
Mm-hmm.
So
Never.
why do they do this to people who suffer chronic pain?
Right.
It's a very real medical condition.
Yeah.
And there's treatments available that really help. And being denied treatments and forced to suffer.
Mm-hmm. And
It makes no sense.
it makes no sense, and it's even a little bit more complicated because this didn't happen because pain patients were abusing their medications. This happened all based on a lie, based on a false narrative that pain patients and their medications were fueling these people that are dying from illicit drugs, and there's no connection between the two.
No.
So it's not even, you can't even say, like, we can't even say with any good faith that, well, pain patients were abusing their medications, so we had to rein this in. That's not the story. That's not the truth. That's not what happened.
No.
No.
Pain patients are very diligent with their medication because they need it, and they know it can be taken away at any time if they do one little thing wrong.
Mm-hmm.
And then they're sentenced to a life of unbearable suffering. So pain patients are not the problem, but they're being punished for it, and it's also not the solution to deny them medication they need. It hasn't stopped the opioid crisis on the street.
Well, no, the more that prescriptions decline, the more the overdose deaths are soaring. There's no statistical relationship between the two. They're two completely different populations with completely different medical needs. They have nothing to do with each other.
Yeah.
Yeah. So I understand you also have someone in your life that's a chronic pain patient. Someone.
Yes. Yes, my husband is. And when this happened in my family, I was heartbroken.
Yes.
And I was also terrified because I thought, is my husband going to be next? And I know without his medication, I don't know if he could stand it, even with his opioid pain medication. My husband spends a lot of time in bed.
Yes.
However, because of his medication, he can have a measure of quality to his life. He can sleep at night, most nights.
Mm-hmm.
And he can get up and do a few things, and then he has to lie down again. If he was denied his medication,
Mm-hmm.
I don't know. I don't know how he would function.
Has there been any indication that that's coming? Has any?
I see that coming as we have our doctor, who is very understanding. Well, the doctor who prescribed the dosage he has,
Mm-hmm.
Dr. David Boyd in London, and a wonderful, compassionate doctor, pain specialist. Sadly, he passed away from cancer.
Oh, that is sad.
So our family doctor, who is new, because our old family doctor retired,
Mm-hmm.
he is going in that direction. She does not want to prescribe this medication. She wants my husband to see a pain specialist who uses, when we looked up information on him, he uses things like ultrasound, and he specializes in post-operative pain. My husband has been in chronic pain for 12 years. It's not a post-operative thing.
Okay.
He had a very serious accident 12 years ago and has suffered extreme chronic pain ever since.
Oh, that's tragic.
And that's my great fear, that he won't have access to his medication, although in 12 years he has never abused it.
Of course.
He has never requested an increase in medication.
Mm-hmm.
He has never run out of a prescription early.
Right.
He is extremely responsible. He keeps his medication locked up.
Yes.
He uses it exactly as it's prescribed. And yet, he is in danger of losing something he needs to live in relative comfort.
Right. Now, I remember you said that, in your email, that your family had begged the doctor to help your uncle to no avail. Was anyone written, do you know, in all of this? Were there any letters that went out?
No, I believe it was all verbal.
Okay. Okay. Do you have any sort of a plan or any thoughts on if this doctor says, okay, we're going to start to taper today?
With my husband,
Yeah.
I would write the College of Physicians and Surgeons. My husband and I have discussed that.
Mm-hmm.
We're going to look for a pain specialist who has some compassion, as I don't believe ultrasound treatments are going to help. Although my husband would be willing to try them, but this is the terrible situation pain patients have, is if they agree, okay, I'll cut down and try something else, and that something else doesn't work, they're not going to get their medication back.
Right. Right. And the problem is that these alternative treatments, as far as the research is showing for any rate of success, it's just abysmal. They're not.
I know.
They're not a replacement for opiate medicines.
No. And even to get the right medication, I mean, there was an awful lot of suffering before he got something that actually gave him some relief.
Right.
So,
did they try? They tried other treatments before the medications.
Yes.
Yeah.
And they tried different medications, and it was the opioids that worked.
Okay.
And I also believe they're the least harmful on the body. This is what Dr. Boyd said, that morphine is actually one of the least harmful to the liver, kidneys. And I've seen other patients, pain patients that I know of, that to try and get enough pain relief, they supplement with things like Tylenol 1 and take far more than the recommended dose because they're trying to get relief. That's terribly hard on the liver. So to me, if it's do no harm, this is what doctors take an oath to do.
Right.
There's a medication that will help alleviate pain, will do less damage to the body than other things. But we're going to take it away because some people have the problem of addiction. Does it make any sense?
No, it doesn't make any sense. It never did, and that's why we work so hard to get the truth out. We're one of the, as far as I can see, one of the few groups. There are others, of course, that try so hard to bust this false narrative. I mean, it's you. There's no refuting it now. All of the evidence shows that these overdose deaths are not pain patients and their medication. They're people suffering from addictions, people trying street drugs, and the street drug supply is highly poisoned now, and that's why they're dying. It's different now. They didn't have this illicit fentanyl before. It was just, I guess in the past you bought heroin, you got heroin, but now you buy heroin and it's laced with this poison fentanyl, and chances are you could end up dead. But again, it has nothing to do with pain patients at all. But the government just insists on conflating these two groups as if they're doing something good, as if they're taking action, but they're not saving one single person who's dying from illicit drugs because they're not addressing that. And now they have a crisis with chronic pain, so they have even more deaths. So instead of decreasing the death toll, they've actually risen it.
Yes, and there's a huge difference between being dependent on a medication to function and have quality of life and being addicted.
Absolutely.
Two different things.
Absolutely.
No one would ever say, oh, you're diabetic, you're addicted to that insulin.
Mm-hmm.
No, you're dependent on it to be healthy and have quality of life.
Right.
And you cannot see pain. You cannot measure it. You have to take somebody's word for it that they feel it.
Mm-hmm.
Although you can see on someone's face when they're suffering. I can tell when my husband's having a bad day. You can see the stress on his face.
Right. And your
But
uncle's anxiety, that's another symptom that he was not medicated well enough.
yes, and but pain is real. It's real, and it's a medical problem. And there are treatments for it that actually do help. And people being denied these treatments is just barbaric, really. It really is.
All of us at CPAC couldn't agree with you more. And please accept our condolences. We're so terribly sorry to hear about your uncle. No one should ever have to be faced with a decision like that and to go through that alone. He must have dug down deep to find some courage to do what he did, but clearly it was out of sheer desperation as they backed him up against a wall and he didn't have any choice because that level of pain is not that's not living. He might have been surviving as in air coming in and out of his lungs, but that's not living.
He had absolutely no quality of life.
Right.
And it's heartbreaking. It's heartbreaking. This is what people are being driven to, and I know it's not just him.
Right.
There's many more.
Right. Well, we wish you all the best. We're going to keep trying. Please, please do keep in touch, Bonnie, and thank you for sharing your story. And I think we'll all have a little bit of your uncle in our hearts today. So
Thank you for listening.
Okay. Take care, and we will keep in touch.
Okay, thank you.
Thank you. Bye-bye.